Fluid deficit and excess can be very challenging. This video is designed to make it simple, straightforward, usable for question answering in nursing school and the NCLEX. Fluid deficit, fluid excess, hypovolemia, hypervolemia. Let this content help you master it. First, let's take a look at the question. We'll come back and answer it. Write the answer down. And after the lecture, we'll come back. A nurse is caring for a post-operative client who has what? Prolonged vomiting and diarrhea. The buzzword is prolonged vomiting and diarrhea. Which assessment finding should the nurse expect? Do you expect bowel in peripheral pulses, crackles in the lungs, capillary refill of 4 seconds, and jugular vein distension? Look at it. Prolonged vomiting and diarrhea, jugular vein distension, capillary refill 4 seconds, crackles in the lung, what? Bounding peripheral pulses. Which of this would you expect based on the client condition? Number 2, a client with what? Heart failure is admitted with what? Shortness of breath and peripheral edema. Shortness of breath and peripheral edema are the buzzword. Which intervention should the nurse anticipate? Infusing lactate ringer at 125, restricting sodium and fluid intake, administering an isotonic fluid bolus, and encouraging increased oral fluid intake. 2 questions talking about fluid deficit and fluid excess. Which of these will you know are you going to use to answer that question? This lecture will help you. Simple, straightforward. First, you have to know what is our body composition. Right now, you're sitting there, listening to me. How much fluid is inside you? Well, your total body fluid, how much fluid is in you, is about 60% of your weight. It can vary based on your age and certain condition, but on average, 60% of your body weight is mostly fluid. So if you weigh 70 kilos, 60% of 70 kilos will be all fluid. But then this fluid is divided into 2. We have intracellular fluid, right? That means this fluid is inside what? The cell. Intracellular, inside the cell. 2/3 of it is of your total body what? Fluid weight. So if you have 60% of your body weight is all fluid, out of this fluid, 2/3 of them is that, which is almost 40%, 40% of that, what? 60%. And the extracellular is what surrounds the cell. And that is what? 1/3. So that is what? 20%. So you can see this look like a 60-40 rule. So you have 60% of your weight is water. And out of these 60%, 40% is cellular, which is what? The 2/3. And then the 20% of that water is what? Extracellular. But the extracellular is divided into 3. You can see questions on that. What is that? The first one is the biggest one, intravascular. So inside your vasculature, that's where the blood is being bathed in what? Plasma. That is 1/4 of that 1/3. That is the 20%, 1/4 of that. Then you have the interstitial between 2 tissues, right? That's the key, which is what? 2/3/4. And then there's a few ones most people don't know about, and it's good to know, and it's an idea. You've seen it before. We call them transcellular. You have to be familiar with them. One of them is cerebrospinal fluid. This is a transcellular fluid. There's some also that you can find in the pleural, in the lung space. That is a pleural fluid. This is also part of it. If you, in your eyes, there's some fluid there, ocular fluid. It's also part of the transcellular. And then synovial, this is in your joint. It's also part of the transcellular. So you can see this is the breakdown of our body fluid compartment. It's good to understand each of them because they're doing a certain purpose. Now that you know how much fluid you have, then what do you ask yourself? Who has a fluid deficit? Most of the fluid will be lost in what? in the extracellular fluid. So in your care, when fluid exceed what you're losing more than what you're taking in, the deficit, like you're losing something, hypovolemia, you have to lose fluid. So okay, when fluid output exceeds how much is coming in. So if you're bleeding or you have a lot of diarrhea, you're losing more than you're taking in. But where is it coming from? Extracellular fluid. So most of the time, all this problem is coming from the extracellular. You don't use the interstitial, you don't use the intracellular, you don't use the transcellular. So when we're talking about fluid status, always consider the extracellular fluid, which is about 20% of what your body fluid. And because extracellular fluid is mostly plasma, is isotonic fluid. So you look losing isotonic fluid, what we call isotonic dehydration. Sometimes you use those words, they try to confuse you. But isotonic dehydration, that means you're losing water and salt at the same time. Now, what are the examples? Think about it. Think about simple examples of condition where you're going to lose a lot of fluid without not taking in, right? GI loss, diarrhea, vomiting. If I put the NG tube in, I'm sucking fluid out of you. That's a problem. You're losing fluid, isotonic fluid, like that of a plasma. If you're bleeding, you can lose blood and then plasma at the same time. If you have burned, the tissue get exposed, the skin get exposed, you lose extracellular fluid and it will lead to dehydration, fluid deficit. If you sweat a lot, you go out and it's hot, you're going to lose fluid and you become hypovolemic and you have fluid deficit. If you take some medications, a certain condition will let you lose some fluid, like diuretic. You're going to lose all your fluid. Diabetes insipidus, a bunch of diarrhea. Diabetes insipidus, a bunch of urine output. You're going to lose your, not be able to absorb all the fluid associated with your urine. Some of them you have to reabsorb back. You're going to lose them. And if you're not drinking a lot, that's the problem. Why do you have to study all this? What is the purpose of that? Why do I have to know this? NCLEX Nursing School is going to ask you. How are they going to ask you? This. What would you see now? If I have lost my fluid, I have a lot of diarrhea, I've been vomiting, I have an NG tube, I have burn bone. What are the signs of symptoms? Pay attention to specific systems. That's the most common. The most common is the cardiac system. That's what they're going to ask you, right? And the cardiac system will shows up of what? Tachycardia. Your heart rate goes up because you want some fluid. Why? Because your cardiac output probably is going to decrease. Remember, your cardiac output is equal to your stroke volume and your heart rate. If you don't have enough fluid, your stroke volume goes down. In order to maintain your cardiac output, you have to increase your heart rate. All this makes sense. So this individual, his heart rate is going to go up. The stroke volume decreases. That's why your blood pressure goes down. You become orthostatic, right? Your pulse is not going to be bounding because there's no fluid. It's faster, but it's steady, right? Weak, steady pulse, right? Even though you tachycardia, when I feel it, it's weak, steady. And your central venous pressure is going to go down because there's no fluid there. This is equivalent to your neck. When I look at your neck, your vein will be flat because they collapse. There's no amount of fluid there. The most common therapy answers you see in nursing school and NCLEX is the capillary refill, which it can be very confusing. Capillary refill is supposed to be lower when you have a lot of fluid, right? If you normal, your capillary refill is less than 3 seconds or 2 seconds. That means if I pinch your fingernail and I release it, blood should just rush back quickly. But if you have fluid deficit, if I pinch your nail and you lose all the blood and I release, it will take a long time for the blood to return. Therefore, your capillary refill should be greater than 2-3 seconds. The word greater means taking a long time, not faster. Once again, greater than 3 seconds means it's going to take a long time for blood to come back to your capillaries. Therefore, look for higher normal for fluid deficit. That is one of the trappiest one of all. So that's what you should expect. This is what the NCLEX will ask you is the signs and symptoms. They may change it in the case form. A patient has what? NG tube. What would you expect? For 3 days, this is what signs and symptoms you should expect. Now, this is not it. What would you see in the neurological problem? Confusion. They're going to get dizzy, restless, they'll be lethargic because they lose some fluid. Then, what do you think your skin will do? It's going to dry up. So dry mucous memory. The skin turgor is going to be poor. It's not going to be taut, right? It will be flat. And your eyes, especially in kids, they will have sunken eye, telling them they have dehydration. You have to know all these signs and symptoms. What do you think your kidney will do? It has no fluid. Your urine output will become low, and your urine will look dark because you try to absorb most of your fluid, and it become concentrated. These are systems you have to pay attention to. And your weight, because you've lost a lot of fluid, which is isotonic fluid, you're going to lose weight. This is what I want you to pay attention to. Know the signs and symptoms. Know what condition causes fluid deficit. Now, what do you think? Lab value, we've seen a little bit of it. The most common lab value they're going to ask you is your hematocrit and your creatinine and your kidney. Your kidney, when it's in trouble and it's not working, BUN and creatinine goes up. Because you lose a lot of water, which is isotonic, most of all the fluid you lost is isotonic, your hematocrit or red blood cells is going to be concentrated. So this is the reason why you may be dehydrated, but your hematocrit may be like 40. It's a trap. It doesn't mean it's normal. It's over concentrated. Your RBC may also will go up. Is because it's concentrated. That is the problem. And urine specific gravity will go up because you're going to absorb most of all the fluid. If they give you a lab value, there's a way you can remember them. Your urine specific gravity normally is this. Specific gravity usually is 1.003 to 1.030. If you have fluid deficit, your concentration will be higher. So you should be greater than 1.030. That's what you're looking for. So these are the things you should pay attention to. They're going to ask you, what do you do as a nurse? Well, you got to monitor their urine output. You got to weigh them to make sure they're not losing fluid. You give them appropriate fluid. Since they're losing fluid, give them isotonic fluid, and then treat the underlying cause. If it's diarrhea, let them stop the diarrhea with medication based on the physician order. And then have some precaution because they're going to be dizzy, orthostatic, all of them you got to pay attention to. How? The opposite is fluid excess. Once again, same thing. You occur when you're taking more than you're giving out. And mostly this fluid is still within extracellular fluid. But what is the problem? The extracellular fluid, you are not losing it. You're just shifting it to the interstitial. This is what causes edema, right? You move it into tissue, interstitial cells. So you go to your lung, you go to your abdomen, you have ascites. The reason why we have all those conditions is because fluid from extracellular compartment into the interstitial compartment. And that is the biggest problem associated with that. Mostly they are all isotonic, like I said. So a few conditions will be hypotonic, like if you have a brain injury, these are the problems. What are the causes? Heart failure, number one. You have isotonic fluid buildup that can go into your lung, fluid excess. Renal failure, you can't get rid of your fluid, you go into your lung. Cirrhosis, too much fluid that stay within your abdomen, you have ascites, this you can't get rid of it. And excessive IV fluid, if you give the individual normal saline too much, you have fluid excess. Of course, SIDH, this is mostly what? Dilutional. You hold it on to water. So it's not extracellular fluid shift, but mostly you're having pure water going to your extracellular system, and that will become a problem. Steroid therapy can also prevent as excessive fluid. What is the next thing? What signs and symptoms are you going to see? Well, they're going to have blood pressure problem. Too much fluid, too much sodium, your blood pressure goes up. Your pulse will be so bounding, right? And they will become tachycardic because everything is going to go up. Elevated CVP, the respiratory status, because the fluid is shifting from the extracellular compartment into the interstitial space, you're going to have dyspnea, signs of pulmonary edema, crackles, pulmonary edema, orthopnea, and cough. So watch for all these things like a heart failure, right? You can see it. You go to your brain, you get headache, confusion, lethargy, seizure. This is mostly hyponatremia. It's severe, right? It's because of free water go into your brain. So that's the condition. If it's mostly neural, it's mostly hypotonic fluid instead of extracellular fluid. And your skin now is getting more fluid. You get edema, you get a JVD, and you're going to gain weight. What are you going to do the nurse and the lab work? Most of the lab work is opposite of what we talk about. Now your kidney is happy. BUN go down, your creatinine go down, hematocrit get diluted, and your specific gravity become dilute. So your specific gravity should be less. So your normal one is 1.030. You have 10, 30, 1.030. Your specific gravity will be here. It will be less than 1.030. So this is the key aspect of that area. Therefore, next intervention, get rid of all the fluid, right? Monitor weight. Like anybody who have heart failure, you can use the same strategy. Restrict sodium and fluid. Administer what? Diuretic. Elevate the individual head out of the bed. Provide oxygen and monitor what? Pulmonary edema. These are conditions you have to be familiar with, what the nurse should do for this condition and what they need to do. So this is the question. A nurse is caring for a post-operative client who has what? Prolonged vomiting and diarrhea. Which assessment findings should the nurse suspect? These tell you prolonged vomiting and diarrhea is a form of fluid deficit. So you're looking for an answer choice regarding fluid deficit. Bound in peripheral pulse, does it look like fluid deficit? Crackles in your lung, fluid deficit, capillary refill, 4 seconds, jugular vein distension. You can look at the answers, you can tell 1, 2, and 4, they are talking about fluid excess. Therefore, the right answer is number 3. This is different from this. A client with a heart failure is admitted with what? Shortness of breath and peripheral edema. Peripheral edema, shortness of breath, this is consistent with what? Fluid excess. Which intervention should the nurse anticipate? No more fluid. Will you infuse LR at 125? Will you restrict sodium and fluid intake? Will you give them isotonic bolus fluid? And then would you encourage them to drink a lot of water? I think we should restrict them because 1, 3, and 4 talking about giving them more fluid, but they don't need any more fluid. They just need to get rid of the fluid. This is fluid deficit, fluid excess, hypovolemia, hypervolemia, and how to answer questions regarding NCLEX and Nurses School fluid and electrolyte. Thank you for watching and good luck in your exams.